Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to complete my series on erectile dysfunction as we go into the specifics of treatment for erectile dysfunction. Part 1 of the series discussed the causes of erectile dysfunction, and Part 2 discussed the evaluation of erectile dysfunction. I will put the links for these other videos in the description. As I mentioned in Part 1, a penile erection involves interactions between many systems within the body, including the circulatory system, nerves, hormones, and psychological systems. And when men are having difficulty with an erection, the problem can be in any one of these systems. Obviously, there are certain ways to treat erectile dysfunction that are very obvious. As I mentioned in my other videos, if it's bad for your heart, it's bad for your penis. So quitting smoking, starting an exercise routine, losing weight if needed, lowering your cholesterol, controlling your blood pressure and diabetes will help treat erectile dysfunction. Certain medications like antidepressants, especially the SSRIs, and hypertensives like beta blockers and thiazide diuretics should be evaluated for their pros and cons, but no medication should be stopped without consulting your doctor. For patients with difficulty in their relationships, counseling can be beneficial. And for those suffering from depression, counseling or medication should be considered. Men that watch a lot of pornography may find difficulty with erections, and I would call on them to limit or quit watching it if they're having difficulty obtaining arousal with their human sexual partner. And lastly, if a man's testosterone level is low, starting testosterone replacement can help restore libido and be one of the ways to treat erectile dysfunction. In my practice, the class of medications I use to specifically treat erectile dysfunction is the phosphodiesterase 5 inhibitors. These include medications like sildenafil or Viagra, vardenafil or Levitra, tadalafil, Cialis, and avanafil or Stendra. One caution is that for men taking a class of medications called nitrates, such as a medication called nitroglycerin, these ED meds are not recommended. And if men are using a class of medications called alpha adrenergic blockers, such as doxazosin, lots of caution should be taken because these classes of medications greatly increase the risk for a dangerously low blood pressure when taken together. The phosphodiesterase 5 inhibitors work by helping increase blood flow to the penis. Let's talk about each one separately. Sildenafil or Viagra should be taken on an empty stomach about 1 hour before sex. I usually start a man with 50 milligrams, and the dose can be reduced to 25 milligrams or increased to 100 milligrams, depending on their response. Its duration of action is about 4 hours. Vardenafil, or Levitra, is now available in an orally dissolving tablet, so it can be taken without water and is thought to have a more rapid onset of action. Otherwise, the traditional tablet has the same onset and duration of action as sildenafil. Vardenafil is best taken on an empty stomach, although it can be taken with food as long as it's low fat. The nice thing about the orally dissolving tablet is that its absorption is not affected by food. Tadalafil or Cialis has a longer duration of action and can be taken 1 hour before sex, but its duration of action is up to 36 hours. And at lower doses can even be taken daily so that the prediction of sexual activity does not come into play. Men simply have to take the medication every day. I find this can be helpful for men that don't want to try and predict their sexual activity. And lastly, the last med in the group is called avanafil or Stendra. It has the most rapid onset of action and can be taken 15 to 30 minutes before sex. Its absorption is also not affected by food, so it can be taken on an empty or a full stomach. Its duration of action is about 4 hours. The most common side effects from these medications include headaches, heartburn, and flushing, and the doses of these meds often need to be reduced in older patients and those with kidney and liver issues. A rare side effect from these medications is a condition called priapism, or a painful erection lasting longer than 4 hours. While many jokes have been said about this condition, it's actually a surgical emergency, and a man that experiences this needs to go to the emergency room because permanent injury to the penis can occur without treatment. In my practice, I usually start with sildenafil or Viagra because it tends to be least expensive. And if the medication is not effective, I'll increase the dose if possible. If a man still does not have a good outcome, then I consider using some of the other medications discussed. For men that don't have a good outcome with oral medications for their ED, there are other treatments including vacuum devices, medications that are placed into the urethra by patients, injections into the penis, or surgery for a penile prosthesis. All of these treatments are beyond the scope of a general internist like myself and require a referral to a urologist. So that concludes my series on erectile dysfunction. At the end of the day, if this is something that you or your sexual partner is struggling with, please bring it up with your doctor because there are lots of options for treatment. Thanks for joining me.